Hi, this is Gary Orris coming at you with another vlog, and so I want to make sure that you're also aware, like us on Facebook and go to our YouTube channel and sign up there, and you'll be able to get these in the future. I also want to thank Linda for this little device that I'm using today. It's got a nice little remote on it so I can control the camera, so it makes a lot of fun. So what I'm talking about today is coronavirus. Of course, that's where all the activity is right now. I'm giving my input, my insight, what I am seeing from my practice. So we're doing a lot of testing in our office. We're probably testing 20 people on average a day, if not more, some days more. And we have had a number of positives. And the tests we're doing, both the nasal swab, which is the PCR, the antigen test, and we're doing the antibody test also. And so we've probably had 100 positives through all this. Of the 100 positives that we've had, 3 have been in the hospital. So you have a 97% chance if you get this infection that you will not end up in the hospital if you're with the group that we're seeing here. And so patients that we're seeing that are positive, they're patients with COPD, they're patients with heart disease, they're older patients, they're younger patients. They're all a great variety. Most of the patients get a few days of a fever, a few days of a cough, loss of smell, loss of taste, exhaustion is probably a common thing, and that's it. They get better. And so the virus is unpredictable. It hits certain people hard. It can unmask other medical conditions. The patient that you all saw, Browns Bridge, the gentleman that was interviewed there, he ended up having a heart attack from it. So the COVID didn't cause the heart disease. The heart disease was already there. The COVID just unmasked it. It was his stress test. And so that's what this can do. It can challenge people that have underlying issues. So bottom line is, I'm not telling you not to wear a mask, but I'm saying the people that are at risk need to stay out of the way. They need to wear the mask. They need to stay at home. But we don't need to shut down our economy and shut down the country because of this virus, because we're just not seeing the numbers. Yeah, there's people dying, and it's terrible. But it's, in my opinion, again, it's like other people have said, it's no different than the flu. We don't need to especially cancel college football, for heaven's sake. But I really feel bad for Fulton, Cobb, and Gwinnett County that they're not playing any sports this fall, because if they're really worried about this virus, they're to the point that they won't allow in-school teaching, how can you let your student athletes be exposed to it in sports? Seems a little hypocritical to me. Toronto Blue Jays not allowing their baseball team to play in their stadium because they're afraid that their players will bring the virus back to their city. Unless Canada's closed, which they may be closed to the United States, they probably have 100 times that number of people coming there on business on a regular basis. So I think some of these changes, some of these things that we're doing just don't make sense. And it's very frustrating to see all this happen. But the good news is I have the antidote. I got the magic bullet for the coronavirus. So therefore, it's not a big deal at all anymore. So what is that? Well, you have to understand, remember that the people that the CDC, Dr. Fauci, the Department of Public Health are telling everybody, you have got to be careful if you're over the age of 60. Those are the people that are at risk. Remember? The ones that we worry about the most. Sure. So how do we beat this virus? And so you say, well, is this going to kill the virus? Not really. Is it going to keep it from being spread? No, it doesn't do that either. What I do is we're going to fool it. Okay? Remember, people over 60 are the ones that are at risk. So what do? We make you look younger. We use cosmetics. Xeomin, Botox, the filler, dermal fillers. These are the things that we want to do to try to help beat this virus. Here's Botox, Xeomin. They're both neurotoxins that block the function of muscle and relaxes the muscles. Bellaterra, Juvederm, and Radiesse. Those are the dermal fillers that help smooth things out and make things look younger. They put the fillers in these. Wait a minute. Maybe I could use a little bit of that stuff. Look at that. That virus won't touch me now. So getting you to look younger, That's the key. That's what we got to do. The virus thinks you're less than 60. It won't mess with you. You get it? It goes away. No problem. Is this logical? Sure. It's as logical as everything else you're hearing on the internet. So why don't we give it a try? So this is great stuff. So I'm going to show you some before and after pictures just to see the difference. Here's the before and here is the after. Okay. Here is the after, and you see how the lines have decreased on the forehead. Here's another before and the after. So it's simple logic. We're going to make you look younger, and therefore virus won't, it may infect you, but it won't infect you hard because it won't think that you're the feeble or the older type folks. And then we win. So this is Gary Orris giving some logical medical advice. Thanks. No animals were harmed in the making of this video.